In the heart of North Guwahati, a medical revolution is taking place. Established in 2014, GNRC isn't just a hospital, it's a commitment to providing a quality healthcare at an affordable price. Today, we delve into the story of GNRC, where excellence meets affordability and patient centricity take center stage. GNRC Medical, North Guwahati, is a modern, inclusive multi-speciality hospital, the first of its kind facility in the world, according to the World Bank. It offers access to quality healthcare, including comprehensive medical, surgical, and emergency care by specialists using state-of-the-art technology at an affordable cost. Meet Dr. Nomal Borah, a driving force behind GNRC Hospitals, a visionary whose journey began in 1982 at the All India Institute of Medical Sciences. Dr. Nomal Borah's dedication to transforming healthcare has left an indelible mark.
Thank you very much for giving me this opportunity. Actually, the story starts from 1982. I was a student in All India Institute of Medical Science in the year 1982, and I continued there up to 1984. I was undergoing training in neurology during that period of time. While studying in All India Institute of Medical Science, I saw the plight of people coming from this region for treatment to All India Institute of Medical Science. And most of the time we were busy in helping and supporting them. And many times we were not able to help them properly. Then I thought, why a place cannot be created in Assam where at least some of these people can be treated there. So I started with an EEG machine, a small lab and a clinic in Maligaon area. The clinic was doing good. People response was tremendous. I used to charge 25 rupees as my consultation fees during those times. But then two things happened. I saw two young men dying in front of me, and I could not save their lives. Then I realized that if I have a small clinic, I'll be able to earn money. So I started from a very humble background. All my probably needs of a aspiring doctor would be fulfilled. I'll have house, I'll have money, I'll have bank balance, I'll have car, but I may not be able to help these young people who will die in front of me, and I'll have to watch them helplessly. Then I realized that in order to help people in the real terms, I need a group of people along with me. I need a team. I need equipments. I need infrastructures. Without that, you really cannot help people very much. I see somebody and I tell them that you go to Delhi, you go to Madras for further treatment. So then I decided to set up a hospital.
Since its inception, GNRC has received a tremendous response from its patient-centric, affordable quality care from community members. The model drew the attention of the World Bank Group, world-famous philanthropies, Bill Gates and several others. GNRC Hospitals has been able to make quality healthcare affordable for all through its affordable health mission. With unique facilities like reduced diagnostic service cost and affordable surgeries, GNRC is leading the way in providing accessible healthcare.
The reason behind this is that we have already started one mission that is known as the Affordable Health Mission, under which we can treat the patient at an affordable cost. Means at a very lesser amount of test investigation. I mean, the expenditure for the patients are very less, and tests that we offer are at an affordable rate, or I would say at an affordable range. So the people of this region, mostly the rural people, they can afford, they can come here, and within the same day they can get the test and they get the result at the same day mostly, and they get a quality healthcare.
Then one feeling was coming to my mind very seriously, that is that private healthcare is becoming expensive. It is beyond the reach of the most of the common people. Even the kind of background, the humble background that I have, those people cannot come to the hospital that we have set up. So then I started thinking, can there be an alternative? Can we do something to bring down the cost so that more number of people can come to private hospital and have quality treatment. So, as a part of that exercise, in the year 2012, I created a model called Medirich program. That Medirich program was a hospital on wheel. I purchased a big truck and created a hospital on that truck. From this analysis, we found out that the most common cause of death of a person in a hospital was he did not come to the hospital on time. By the time he reaches the hospital, it becomes too late. Treatment does not work. And the reasons for coming to the hospital lately primarily is financial hardship. Second is lack of awareness. So this hospital, the GNRC Medical, North Guwahati, was started on those three premises that one of the important focus should be preventive health care. We'll work for making people, keeping people healthy and disease free. Number two, we'll create health awareness so that they come for treatment at the beginning of the illness, not late. And number three, we'll do everything possible to bring down costs and at the same time make it sustainable, keep it sustainable, so that more number of people can come for treatment in a private hospital also. With that three premises, we started this hospital in the year 2012.
The hospital goes beyond medical care, providing free bus services for patients, free 24/7 ambulance service, and utilizing locally available materials for an environment-friendly infrastructure.
In order to create accessibility, what we have done, we have created a fleet of transport services. We have nearly 100 transport vehicles which commute from different places in Assam to the hospital and take the patient back to their own communities. That we have around 50 ambulances which are being placed in different parts of the state. People can use those ambulances, come to GNRC, and while reaching GNRC, after reaching GNRC, there are also a lot of schemes from them so that rich and poor alike can avail the treatment. Then for the emergency patient, those who come through these ambulances, once they reach the emergency, there is no registration fees, no consultation fees to be paid to the doctors. Number of blood tests are being done free, which are usually required by an emergency patients. All X-rays are free, ECG test is free. Then the primary care facilities are also, we are providing all the Sashtomitras, the community health worker, we call them Sashtomitras. On any day, around 1,500 to 2,000 of them would be functioning in the community. They will carry a blood pressure instrument, they will carry a glucometer.
Recognizing the healthcare challenges in rural Assam, GNRC initiated the SURA Project, aimed at providing local support for preventive and promotive health. This project trains local individuals to create health awareness and guide their communities in seeking timely medical attention.
মোৰ নাম শ্ৰী ৰুমি দত্ত কোঁৱৰ মই GNRCৰ স্বাস্থ্য মিত্ৰ হয় 18/5/18 চনৰ পৰা মই GNRCত স্বাস্থ্যকৰ্মী হিচাপে কাম কৰি আছোঁ আৰু মোৰ কাম হৈছে গাঁওবিলাকত সজাগ আৰু সুস্বাস্থ্য আৰু হেৰি কৰি ৰাখাটো তো মই ঘৰে ঘৰে গৈ তেওঁলোকৰ খা খবৰ ল'ব লাগে আৰু সজাগতাৰ বিষয়ে মই ক'ব লাগে আৰু মানুহখিনি যাৰ কিবা অসুবিধা হৈ আছে প্ৰবলেম হৈ আছে সেইখিনি মই জনাৰ পিছত মেডিকেললৈকে আমাৰ GNRC গাড়ী আছে তাত আমি লৈ যাওঁ আৰু ডক্টৰক দেখাওঁ সেই বিভাগৰ ডক্টৰক কিছুমান পেচেণ্ট আয়ুষ্মান কাৰ্ডৰ জৰিয়তেও হয় সেইখিনি আমি আয়ুষ্মানৰ থ্ৰুৱেদি সুবিধাখিনি কৰি দিওঁ তাত তেওঁলোকে সেইখিনি সুবিধা লাভ কৰে আৰু আয়ুষ্মানৰ আমাৰ স্বাস্থ্য মিত্ৰ 3000 মান আছে
নমস্কাৰ মোৰ নাম জিন্তুমণি কোঁৱৰ মই GNRC মেডিকেলৰ বিষয়ে ভালকৈ শুনিছোঁ মানে কি সকলোখিনি ট্ৰিটমেণ্ট সুবিধা ভালেই পাইছোঁ বিনামূলীয়াভাৱে মোৰ অপাৰেশ্যনটো গৰ্ভপাতৰ ষ্ট'নৰ অপাৰেশ্যনটো হৈ গ'ল আয়ুষ্মান কাৰ্ডৰ সহায়ত পইচাও ভৰিব নালাগে এখন সুন্দৰ আৰু পৰিষ্কাৰ পৰিচ্ছন্ন থকা মেডিকেল হয় তাৰ ষ্টাফবোৰৰ ব্যৱহাৰবোৰ বহুত ধুনীয়া বন্ধুত্বপূৰ্ণ আয়ুষ্মান ভাৰত কাৰ্ডখন মই এটাই অনুৰোধ জনাওঁ যে সকলোৱে আয়ুষ্মান ভাৰত কাৰ্ডখন বনাই লওক কাৰণ সেইখন কাৰ্ডৰ সহায়ত মই বহুখিনি সকাহ পাইছোঁ আৰু অপাৰেশ্যনৰ সময়ত মই পইচাও যোৱা নাই হালকি ঘৰত যিটো মানে হেৰি মানে থকা হয় যিজন মানে মোৰ এটেণ্ডেণ্ট হয় এটেণ্ডেণ্টৰে অকণমান থকা খোৱা খৰচটো হেৰি কৰিছে, বাকীখিনি মই টকাও মানে মেডিকেলৰ আণ্ডাৰত ভৰিব লগা হোৱা নাই, বিনামূলীয়া মানে গোটেইখিনি ট্ৰিটমেণ্ট পাইছোঁ।
Initially, we were doing it on our own. There was no other support. But in 2018, when the government of India initiated the Ayushman scheme, Ayushman Bharat scheme, that was a big support for us. So I think that personally, I think it's a great scheme. So our Saistro Mitras are trying to create awareness amongst the people regarding the benefits of these schemes. So initially, the number of though the cards were given to almost 31% of the people, very few people had come forward to take treatment. But once our Saistro Mitra went into the community and went house to house to explain to the people about these schemes, then the number of people who are coming forward to take treatment with the support of the schemes are quite significant, quite significant. And we have in this hospital, 55% of our inpatients are Ayushman patient only, both from the Prime Minister Ayushman scheme as well as from the Chief Minister Ayushman schemes.
এইটো বিষয়ে আমি যে আয়ুষ্মান কাৰ্ডৰ বিষয়ে যিটো আমি সুবিধা পাইছোঁ, এইটো আয়ুষ্মান কাৰ্ডৰ মানে ওপৰত ভিত্তি কৰি আমি GNRCত আহিছোঁ, আৰু GNRCত আহি কিনে আমি ভালে এটা সুবিধা পাইছোঁ। যেনেকৈ আপোনাৰ ইয়াতে আপোনাৰ ICত এডমিশ্যন ফিজ পূৰা ফ্ৰী পাই আছোঁ, মেডিচিন চাৰ্জ ফ্ৰী পাই আছোঁ, আৰু আপোনাৰ যেতিয়া অপাৰেশ্যন হয় অপাৰেশ্যন চাৰ্জটো ফ্ৰী পাব বুলি আশা আছে। আৰু আমাৰ যিটো ফেমিলি আছে ফেমিলি চবকেইটা আৰু আয়ুষ্মান কাৰ্ড মানে বনাইছে, আৰু জানো যে এইটো 5 লাখ টকালৈকে মানে সুবিধা আছে আৰু।
GNRC Medical stands out not only for its commitment to affordability but also for its comprehensive facilities. From advanced diagnostic services like CT scans and X-rays to a fully equipped blood bank and a workshop for crafting hospital equipments, GNRC ensure quality healthcare at every step.
Our model is like that. Patient will come, get registered, get the consultation from the doctor on the same day. Then after consultation, most of the tests would be done on the same day. Results also would be made available on the same day. Then they can go back to the doctor. He would be sitting in the OPD because they are all full time. Then they take the prescription, buy the medicine from the hospital pharmacy. Then they can go back home in the same bus. So that saves their time as well as money also. And it is convenient. They don't have to keep on coming repeatedly for the same job. We want to set up hospital at districts level, at least 1 hospital bed for every 1,000 people. 4 beds are needed. GNRC model should be able to fill up 1 hospital bed for every 1,000 people in the state of Assam to start with. That's my future dream.
With its commitment to affordability, technology and patient-centric care, GNRC stands tall as a testament to what can be achieved when healthcare is made accessible to all. This is not just the story of a hospital, it's a story of hope, resilience and a healthier future for all. With camera person Mosam Deka, this is Krishna Medi reporting for India Today NE.